Let me start. Dr. Sridhar Felix, Dr. Girinath, who was supposed to be here, programs in this country. Apollo has trained people in it. 90 of them have people who have been trained at Apollo. So it's not just what we directly do. It's not what we directly do. It's the impact we have on the healthcare of the country. So we will train, we will share, our registries will be open for everybody to be part of. Our GenWorks will be a training program. Our Microsoft Risk Prediction Score will be a global score of pooling of data. Everything that we know in the pursuit of science will be shared with the medical community to impact and touch more lives. So Dr. Sridhar Felix, please tell us, in the realm of heart surgery, we know what you've done. What do you think is the future? Where is this going? And I know heart surgeons are becoming minimally invasive, and cardiologists are becoming extremely invasive. So where is this going? What do you think?
Well, first of all, I'd like to thank you for giving me this opportunity to attend this excellent meeting.
We're so glad you're here.
And I must thank my mentors, our chairman and Dr. Girinath, who's not here.
Right.
And what was your question, sorry?
So where is heart surgery going? How can we reach out to the number of people who need it? What more can we do? What makes you proud of the heart surgery that's happening at Apollo? And just share your thoughts.
Well, when I see my patients who come back after 15 years, 20 years, totally asymptomatic, walking around, leading a normal life, that's when you feel that you've done a great work for these patients. And where do we go from here is, I don't think heart surgery has reached its
Zenith.
It's more to come. And like when you talk about technology, talk about minimally invasive robotic work, it's going to go that way, in that direction.
Perfect. So,
and more of technically more demanding arterial grafting. Things are going in that direction now.
So that's just wonderful.
All to favor the patient for better long-term results. It's been proved that a patient, they're looking at a one-time surgery, one-time treatment for these patients. So that's what we want now.
So that's amazing. Ladies and gentlemen, Dr. Sridhar Felix could have told you, we have the latest, most amazing heart lung machines. We pioneered off-pump surgery in this country. We've brought down the costs. We have the fastest cycle time, off-pump, on-pump time. He could have told you 100 technical things. But what did he say? It's the smile of the patients who come back 15 years later, which is what inspires him. Thank you. Sitting right next to Dr. Sridhar Felix is Dr. Chonkalingam. Dr. Chonkalingam is, I think, Chennai's most famous cardiologist. And everybody loves to be treated and touched by him, something like I saw with Dr. Chonkalingam on the occasion of World Heart Day, which is just tomorrow. Can you share with us what you think is the future of cardiology? Yeah, you please come. Okay.
I really appreciate and wish you all a very happy World Heart Day. And today, glad to inform you, I completed 51 years of cardiology, getting to 52nd year. My 51 years of journey, to be very honest, it has been with our chairman 51 years. How he started our journey along with him. And I know, I wish, I think the way in which you are talking, Sangeeta, it looks like a cardiologist. The reason is you have been involved in that. One or two comments I'd like to make for this excellence. In the futuristic vision, I really appreciate our chairman. He has considered chairman with his team with a very hard commitment and excellent way. This vision, he has made it as a mission and doing it with great passion. The reason why you are able to have the journey so nicely. Recently, I addressed 18,000 physicians in San Francisco. The important topic there was the burnout phenomena among physicians and cardiologists. Globally, it's catching up in India too, Sangeeta, that the tendency for depression, suicidal, and heart attack has become very common among doctors. More so among cardiologists. So please escape from that ourselves first with vision of our chairman.
Wonderful. Thank you so
Another
much.
one small comment. As you have been insisting on prevention, please go ahead, Sangeeta. Primordial prevention, primary prevention, secondary prevention, tertiary prevention, every aspect prevention. Please follow all of my colleagues and friends, 3 mantras. Be positive in thinking, be healthy in eating, be adequate in exercising. Nobody will get in heart trouble. And all 3 killer diseases in the world, heart attack, cancer, accidents, are all lifestyle diseases or negative one. Preventing that one becoming, making our life is a positive, nothing will happen. Please remember, please avoid hurry, worry, curry to get buried. Thank you very much. And before I go, please all of you get up for a second. All of you please get up. Why I am making to get up is, please give a very big hand to Professor, Chairman and team for excellent work they are doing. Very honored, Professor. And having accepted this invitation, you are all now coming. Please give a great appreciation for yourself.
Yes.
If you like to talk, give me a clap. Otherwise, don't bother. Thank you. Thank you.
It's very much like your talk. Thank you, Doctor. Give a big hand. Thank you doing so much. I have seen
Created by the Honorable Prime Minister's office to strengthen. We also have.
They are grateful to you, and I am happy that we started it 36 years ago, and today they have all made a significant impact in making a difference and giving back that life for people who otherwise would have died, like my first patient. And when I see all of this, it goes back to my house surgeon days, when Madras had one electrocardiogram. Our professor of medicine, Dr. Ratna Subramaniam, he would lock it at 5 o'clock, go away. So the next morning, all night we would have seen patients and would have written the requisitions. He said, now prioritize any 20 of those that we will do today. And then it will go to a cinema studio to develop that film. So that is the ECG. I don't think you all would have seen it, except maybe one or two in the whole crowd. Today, electrocardiograms have become an almost easy task. But what was difficult was the interpretation of ECG. Very few knew that. But I should not just thank the entire Indian community, and the world is going to be very grateful for the great work that GenWorks has done. And I'm very happy that GE and Wipro, especially what he has done and what he is doing for charity, giving 50% away of his property for charities. I thank him and I congratulate Wipro and GE for this, and thank you, GenWorks, for giving us this modality so that the BCG is done in a remote place. The doctor can keep the instrument, but he can't learn all about it in no time because he has many things to do. So I'm happy that you brought a great initiative to see that people in the remotest places get this benefit. It brings me back, when we did the first satellite telemedicine. You know how it happened? My village was connected to Hyderabad and to the exhibition grounds when then President of the United States, Bill Clinton, came to India, and we told him to inaugurate satellite medicine in the world. So he said, what, in the world? And anyway, let me see. But his daughter was goading him. Dad, you do it, it's fantastic. So anyway, he just unveiled, and he saw in my village a young girl, 14-year-old, being examined, and a cardiologist that Dr. Seshagara Rao, our first cardiologist in Apollo, he was reading that echo there and then told the mother of the child, saying, "You've got a hole in the heart, and when it's during vacation, you bring us to Apollo, and when we'll patch this up, and when school reopens, you can rejoin the school." He didn't stop there. He said the next word, saying, "Your daughter will lead a normal life." Tears ran down Bill Clinton's eye. He told me, "Dr. Reddy, this is a very, very wonderful thing that you've done. The rest of the world should follow your lead so that people in the remote places can get the benefit of high-tech medicine." This is what GenWorks has given today. Even if you give ECG at that time, we'll make it happen. Thank you.
Thank you. I would now like to invite all of our Apollo cardiologists.
In the world, a very happy World Heart Day. When I say happy heart day, we're saying we don't want any of you to suffer from heart disease, because there is so much knowledge that's available, there is so much research that's available, and of course in treatment, both in cardiology and cardiothoracic surgery, the world has progressed to a very great extent, and I'm happy Apollo and the rest of the good hospitals in India are equal to the best hospitals anywhere in the world. So that is their care. But I think my bigger message is that you must take care of what we are called, because this is one of the part of NCDs, non-communicable diseases, which is very, very critical in today's healthcare. It is like a tsunami. According to World Economic Forum, 80% of the deaths are going to be from NCDs. And what are those NCDs? Diabetes, heart disease, strokes, cancer, and infections. These 5 are going to be causing that damage. It's not going to be a big loss for their families, but even for the country's progress, it's going to severely affect. And more importantly, the cost is frightening. Cost for the world is going to be $30 trillion. For our country, it's going to be $4.8 trillion, which is 50% of the GDP. We are now spending, public is spending 5, government is spending 1.25, 1.5. So we need to save that money by following the advices that we are giving on Heart Health Day, and use many of the new applications that are available. Our research with Abbott and Microsoft is now able to predict earlier enough that a person is prone for heart attack. So if he then follows the cardiologist's advice, he will not get that heart attack, and his family will be happy, the country will be happy. Similarly, the new GenWorks, the instrument which can transmit an ECG from anywhere, from remote villages, it can transmit to a cardiologist who will be able to give instant interpretation whether the patient needs any care or not, and if the care is needed, he will suggest what type of care could be given. So I think this is all available, and Apollo has already started this in the country. Very soon, we would want Apollo and others to join and cover, so that every individual, when it is necessary, this is available for him to save his life and give joy to their family. God bless you all, and wish everybody on World Heart Day healthy heart for all of you. God bless. Healthy heart for every single individual. It's a very important organ. The heart pumps for all of us 30 miles every day. It pumps from your first breath till the last breath. It is such a vital organ, and we say, pleasantly also say, you have got a good heart. I hope that word will come true for all of you. Have a good heart.